Guided tissue regeneration, GTR. This is one of important topic in periodontics which can be asked as a long essay or short essay. Ideal periodontal therapy should aim at regeneration of the lost periodontal structures due to periodontal disease. GTR is one such procedure. GTR is defined as method of prevention of gingival epithelial tissue migration along the cemental wall of the periodontal pocket by placing a GTR membrane. So, this area is the last periodontal attachment area. So we have overlying gingival tissue. This is the gingival tissue. So we'll place GTR membrane here. This is the GTR membrane. Okay. So what we are doing? We are preventing gingival epithelial tissue migration to the underlying defective area. Okay, this is the cemental wall of the pocket. So we are preventing gingival epithelial cells migration to the cemental wall of the pocket. So this is the definition of the GTR. Then coming to the principle of the GTR. GTR works on the principle of Melcher's concept. Melcher's concept. Okay. According to Melcher's concept, this defect can be repopulated by the cells from the four regions. Okay. They are, let's take this as a tooth and this is the bone. Okay. This is the bone and this is the gingival tissue. Okay, right. So this is epithelial tissue and this is connective tissue. Okay, this is bone. Okay, and this is pedial. This is pedial. Okay, so this defect area can be repopulated by the cells from the epithelial tissue, gingival epithelial tissue, or from the connective tissue, or from the bone, or from the pedial cells. There are four possibilities. So, if the gingival epithelial tissue or connective tissue repopulates this area, they will form long junctional epithelium. Long junctional epithelium. Okay. If bone cells reach first, then they will form ankylosis. Ankylosis. If pedial cells reach first, then they will form new attachment. New attachment. Okay. So say the type of cells which reach first in this defect area will determine the type of outcome. So if epithelial tissues and connective tissues which are fast growing, they will form long junctional epithelium. So if there is no GTR membrane in between this, we will place GTR membrane here. Okay, in between the gingival tissues and defect area. That will separate gingival epithelial and connective tissues away from the defect area. So if there is no GTR membrane in between, then the fast growing epithelial and connective tissue cells will automatically repopulate this defect area, forming long junctional epithelium. But that is not a ideal repair procedure. So, by placing GTR membrane, we are promoting bone and pedial cells to repopulate this area. That is called as new attachment. That is the ideal one. Okay. So, this is the basic principle of GTR, Melcher's concept. Then coming to the objectives of the GTR procedure. We are aiming to prevent the migration of the gingival epithelial tissues. So, first objective is to prevent the migration of gingival epithelial tissues. Then, second one is to promote the cells from pedial and bone to repopulate the defect area to give the new attachment. And third one is to maintain the defect, maintain the size of the defect Then coming to the membranes we use, GTR membranes. Ideally, the membrane should be biocompatible, non-toxic, and it should be a cellular barrier. That means it should inhibit the migration of the cells, and it is slightly economical. Then coming to the classification, GTR membranes are classified as non-resorbable and resorbable membranes. Non-resorbable and resorbable membranes. Okay, under non-resorbable we'll have millipore filters and polytetrafluoroethylene, expanded polytetrafluoroethylene, and titanium reinforced polytetrafluoroethylene. This one, expanded polytetrafluoroethylene, is called as Gore-Tex. Gore-Tex. That can be asked as a separate 2 marks question. Okay, these are non-resorbable membranes which are available. Under resorbable, we have polyglycosides. So, basically, non-resorbable membrane are easily available and they are cheaper than resorbable. Non-resorbable need second surgery to remove the membrane, which is not needed for resorbable membranes. And non-resorbable have the complication of membrane exposure. In resorbable, we can't see them. So these are the main membranes which are available and the advantages and disadvantages of those membranes. Then coming to the indications of the GTR procedure. GTR procedure is ideally suitable for narrow and circumferential defects. They are, the first one is 2 or 3 walled defects. 3 walled defects. And second one is class 2 furcations. Class 2 furcations, and these are also indicated in narrow and circumferential defects. GTR procedure can also be done in alveolar ridge augmentation. And this can also be done in immediate implant placement. To fill the defect in extraction sockets. So these are the indications of the GTR. 2 or 3 wall defects, class 2 furcations, narrow and circumferential defects, alveolar ridge augmentation, immediate implant placement. So there are some contraindications. We cannot do GTR procedure in persons with poor overalizing or smokers or otherwise 1 wall defects or class 3, class 4 furcation areas. So there are some of contraindications of GTR procedure. Then coming to the actual surgical procedure of the GTR. GTR can be done as an isolated procedure or it can be combined with bone graft or with root biomodification procedures. So we can do GTR as an isolated procedure, or we can combine this with bone grafts plus GTR, or we can also combine this procedure with root conditioning, that is root biomodification. First we will do root conditioning, then place bone grafts, okay, then go for GTR. So we can perform this procedure in these variety conditions. Okay, so basically the procedure will have access flap. We have to take access flap, that is exposure of the defects by taking clavicular incisions in the defect area. Then raise the full thickness flap, okay, then completely debride the granulation tissue in the defects, completely remove the granulation tissue in the defect, that is debridement. Then decortication, make small holes in the cortical bone to promote the healing, decortication. Then membrane placement, otherwise we are doing with in combination with other procedure. Then we have to do root conditioning, after that bone grafting, okay, after that we will place GTR membrane. Okay. If we are not going for this, then directly we have to take the GTR membrane, then customize it to the defect, then stabilize it. Stabilization of the membrane to the defect area with a suture. We have to stabilize the membrane to the defect area with a suture. If we are going for root conditioning with citric acid like that improves the chances of periodontal regeneration, periodontal new attachment procedure. Then we have to do the root conditioning, then place the bone grafts, then GTR stabilization. Okay. Then after that we have to do flap closure with sutures. Okay, closure with sutures. So this is the procedure. First we have to take the flap, regular incisions access flap, then we elevate the full thickness flap, then completely debride the granulation tissue, then decorticate the cortical bone, then we may do root conditioning and bone grafting. After that we have to choose suitable GTR membrane, customize it to the defect, and then stabilize it with to the defect with a suture, then close the flap. This is the surgical procedure. After 4 to 6 weeks, membrane should be in place for at least 4 to 6 weeks. After 4 to 6 weeks, in cases of non-resorbable membranes, we have to do the second surgery to remove the membrane. Okay. In case of resorbable membranes, there is no need for second surgery. Then coming to the complications of GTR procedure. In resorbable membranes, we may encounter membrane exposure, premature membrane exposure. So in that case, premature membrane exposure. In that case, we should not remove the membrane. It should be in place for at least 4 to 6 weeks. Okay. Any chances of infections are managed with chlorhexidine gluconate ointment. Then patient should be advised to maintain proper oral hygiene. Then post-operative care, we give routine antibiotics and analgesics for at least 5 days after membrane placement, and with normal oral hygiene instructions and chlorhexidine mouthwash. So sometimes this GTR, guided tissue regeneration, can be asked as GBR, that is guided bone regeneration. Question may ask as GBR, guided bone regeneration. This is similar to guided tissue regeneration, but only we are aiming to regenerate bone. For say, take this is the bone and this is the defect area, okay, and this is the underlying gingival tissue. So we will place GTR membrane like this. So this is the GTR membrane. So in guided bone regeneration, this bone defect will be regenerated by the cells from the bone only. By placing GTR membrane here, we are preventing this gingival epithelial tissue cells to migrate to this bone defect area. This is prevented by the GTR membrane. So this is principle wise, everything is similar to guided tissue regeneration, except we are aiming to regenerate only bone, guided bone regeneration. If question is asked like this GBR, we can write in detail about GTR also, except from we are aiming to regenerate bone cells only. Okay, this is GTR. Important for undergraduate students